So top officials from the World Health Organization, including the Director General Tedros Ghebreyesus, are giving a press briefing. It's a weekly press briefing on the latest developments on COVID-19. Let's take you to Geneva, Switzerland right now.
Communication and an engaged, empowered and enabled population, it's never too late to turn the tide. In Europe, countries have done it. In Asia, countries have done it. In the Pacific, countries have done it. In the Middle East, countries have done it. In Africa, many countries have done it. In the Americas, countries have done it. And in the Pacific, countries have done it. In every region, countries have been able to develop a collective blueprint for suppressing the virus and working to save both lives and livelihoods. WHO will continue to support national action plans through our regional and national country offices and spread these lessons of success across the globe. This is a critical moment in the outbreak response. We urge every single leader to strengthen their response, put targeted measures in place that we know can suppress the spread, ensure that health systems and workers are protected, and saves lives. For us all, the fastest way for us to get through this is to act together. If we all keep doing the basics, physical distancing, hand washing, mask wearing, coughing and sneezing safely away from others, avoiding crowds, and keeping windows and doors open when you can't meet friends and family outside, together we will suppress this virus. And when we are able to successfully control it, it's important governments keep going. Stay vigilant and be ready, and keep investing in your national health systems, including contact tracing. As well as focusing on their own national context, it's important to also drive global solidarity by investing in global public goods. This week, we were pleased that countries stepped up and announced $1 billion of new funding for the ACT Accelerator, which is driving progress on diagnostics, treatment, and vaccines. On Monday, we announced that WHO had approved our first antigen-based rapid diagnostic test for emergency use listing and had secured supply of 120 million tests for use in low and middle-income countries. The emergency use listing procedure streamlines the process by which new or unlicensed products can be used during public health emergencies. It's designed to provide information to procurement agencies and member states using an essential set of quality, safety, and performance data provided by the company. Today, we're pleased to announce that we have finalized approval for a second antigen-based rapid diagnostic test to be granted emergency use listing. These tests are simple to use and provide reliable results in approximately 15 to 30 minutes, rather than hours or days at a lower price. And we have also published today a call for expressions of interest for manufacturers of COVID-19 vaccines to apply for approval for pre-qualification and/or emergency use listing. Like with the new rapid tests, WHO looks forward to receiving expressions of interest for COVID-19 vaccine. Then, through our ACT Accelerator and COVAX facility, we will ensure that any vaccines that are proven to be safe and effective are rolled out equitably across the world. I have said it before, but it's worth repeating. Sharing finite resources from tests to therapeutics to vaccines isn't charity. It's the smart play for all countries, as it will ensure that they can protect those at most risk, like frontline health workers, and ultimately across the world, this is the strategy to save lives, stabilize health systems, and ensure a truly global economic recovery that helps us to recover together. I'm pleased to say that 168 countries have now joined COVAX, and another 25 have told us they will do soon. This sends a very powerful message of solidarity across the world, that we are uniting to end this pandemic for the sake of all humankind. There is something very important I want to speak about now. I want to address some of the disturbing news from the Ebola response in the Democratic Republic of the Congo regarding reports of alleged sexual exploitation and abuse by people identifying themselves as working for WHO. To be very clear, we are outraged to read these reports. WHO works around the world in the toughest emergency environments and situations in the world. We come to save lives and spread hope. The betrayal of people in the communities we serve is reprehensible. We will not tolerate behavior like this from our staff, contractors, or partners. Anyone identified as being involved will be held to account and face serious consequences, including immediate dismissal. I have initiated an investigation of the specific allegations as well as broader protection issues in health emergency response settings. WHO has a zero-tolerance policy with regard to sexual exploitation and abuse. I take these reports very seriously, and I will have more to say on this very soon. Before I turn back to Fadila, I want to leave you on a message of hope. Yesterday, on International Day of Older Persons, I had an inspiring conversation with Captain Sir Tom Moore, who raised nearly £40 million for the United Kingdom's National Health Service with a charity walk. And just today, we received a message from Janet Bank of Durban, South Africa. Janet, we know you follow our press conferences, and I want to say hello. Thank you for the beautiful key rings from Mozambique and Zimbabwe, and for letting us know about the amazing story of Ida Ezekweti, who at 99 years of age was able to defeat the coronavirus. We're all in this together and across the world. We will continue to drive science, solutions, and solidarity until we beat this virus together. So from myself, Mike, my general, Maria, and thank you also for sending another one to my daughter, and to Gabi. We all appreciate and express our gratitude for your gift the whole way from South Africa. Thank you so much. And one day we hope we will be able and will have a chance to see you in person. Thank you so much.
Thank you, Dr. Tedros. We will now open the floor to a question from journalists. I remind you that you need to raise your hand. Use the raise your hand function on Zoom in order to get in the queue to ask questions. I would like to just make a small correction. Today, unfortunately, we do not have Portuguese translation, so apologies for our Portuguese-speaking journalists. I would like to invite Michel Cortes from Bloomberg News to ask the first question. Michel, can you hear me?
Yes, I can hear you. Can you hear me?
Not very well. Hello, Michel? Michel? Can you please unmute yourself?
Can you hear me?
Yes, now very well. Go ahead,
Perfect.
please.
Thank you so much. Yes, I wanted to ask you first if you can walk us a little bit through the case fatality rates that we're seeing here, the most updated numbers, of course, around the ages of, say, 60 and 70. Wondering, of course, I know you won't want to speak specifically about President Trump, but just what expectations are given the circumstances and whether or not the amount of social distancing, mask wearing, that type of thing that we're seeing at the White House is appropriate. And then on a completely different topic, a question on why Spain has had such a severe outbreak while Italy hasn't at this point. Thanks.
Thank you, Michelle. I would like to invite Dr. Maria van Verkock to take your first question.
Thanks very much for the question. So the estimates of the case fatality ratio, which is the estimates of the number of cases of deaths over the number of cases of reported, to date vary greatly by country, and they vary greatly over time. One of the things we know about the risk for severe disease and death is if you have underlying conditions, if you are of older age, above 60, above 70, above 80, you have a higher risk of death. What we're looking at in terms of the case fatality ratio, it's a crude estimate because estimates of mortality are underrepresented at the present time. And so they're crude. That's why I say that they're crude. And they vary by country. In some countries it's less than 1%. In some countries it's over 20%. But we do know that the case fatality ratio increases by age. The other measure that we look at is what's called the infection fatality ratio. And this is the number of deaths divided by the number of total infections. And you've heard me say before, there are some estimates of the infection fatality ratio, which overall is around 0.6%. But that also increases dramatically by age. And so what we advise, as we have advised from the beginning, is a comprehensive approach to not only prevent people from developing severe disease and dying, but also to prevent infections. Because the more infections we have, the more opportunity there is for those infections to reach people of older age who are at a higher risk of dying.
You asked specifically about the differences between Spain and Italy. Perhaps Bruce may also be able to offer some insights in that, given that he's worked closely with our regional team and with both countries over the last number of months. I think it's very difficult to compare countries at any particular moment because the evolution of their epidemic is at different stages. Clearly, Italy, way back earlier in the pandemic, was perceived to have done badly because it was hit badly and taken unawares. And then as it recovered, we saw the numbers in Spain deteriorate. This time round, Spain has had a deterioration earlier. Italy, in that sense, has coped better. But as we spoke again previously about Africa and other places, it's very hard to say that people are out of the woods. Relative performance versus just unpredictable events that can occur and can amplify disease in particular settings and can set off these brush fires, particularly in urban settings, that can be very difficult to control. We've seen that in Australia, we've seen that in China. You can have very small events that can actually spark a major issue within an urban setting in particular, and that can make a country look very far behind the curve. We also have the artifacts of testing and other things that we have to be very careful when we compare countries. Both countries have really had to fight very hard. Both countries have really had to adapt their systems. They've had to dig deep to improve their public health systems, to shore up and strengthen their health systems, and really has required a massive social effort. And you certainly see that particularly in Italy, where there's been a huge reimagining of the social contract that I think is having a great impact in keeping the disease under some degree of control. But Bruce has been much closer to offering direct technical advice. You may wish to make a comment on either country, Bruce.
Thanks, Mike. I think I would first just add to Mike's recognition of the extraordinary response that we saw in both countries, both Spain and Italy. When working in both countries, in Spain in particular, it was just extraordinary. The breadth and depth of the response, the commitment of the healthcare workers, of the ministries, of the governments, at all levels, but of the general population. Madrid was an extraordinary place, as was Barcelona and the other places we visited while in the country. To see that level of cooperation and solidarity in trying to beat this virus, and very much reflecting, I think, some of the advice you, the Director General, have always been giving countries and individuals. You really saw it play out in both countries very impressively. And I think, to the point Mike made, we're dealing with a biologic process, and we don't understand everything about this virus and everything about why it takes off in some places and doesn't in others. And when it takes off in some places, undoubtedly what we're seeing is a very rapid and sometimes very subtle shifts in behaviors in other countries that just help keep them from hitting a tipping point. It's clear that there's tipping points with this virus, and as soon as you get behind that 8 ball, it's very, very difficult to get it back. So part of this is like Mike said, it's bad luck, because in both countries you've got very, very impressive responses, very well-trained people, and populations that really know what they're doing. So I think at this point our thoughts really with the Spanish people in particular, who are going back into some very, very difficult decisions right now as they try and get this virus back under control. And I think we have full confidence they will, because they've got the experience, the expertise, and the commitment to do that. I think we'd also note, and Micah, you may have mentioned it, that there are parts of Italy where we are seeing it's heating up, and they're moving very, very quick to try and address that as well.
Thank you. I would like now to invite Catherine Fioncan-Bokonga, France 24. Catherine, can you hear me? Okay, I would like now to invite Agnès Pedrero, AFP. Agnès, can you hear me?
Yes, I can hear you, Fadela.
Yes.
Hello, everybody.
Yeah, we will come back to Catherine later on, but Agnès, we can hear you very well. Go ahead, please.
Yes, thank you. I will ask a question that was just asked, but I didn't listen any answer. I wanted to know if you think that the US president disregard for the mask had made it inevitable that he would be infected at some point. Thank you.
Mike Ryan, Dr. Mike Ryan, please.
Yeah, I think we don't generally comment on the behaviour of any specific individual, and we don't know what risk management measures were in place around any given individual, especially someone as prominent as a president. What we will reiterate is that each and every individual and each and every citizen should be guided by the national guidance in their country, and that the combination of different measures that reduce risk, and we know these reduce risk: washing your hands, staying a safe distance from other individuals, avoiding crowded spaces, wearing a mask, both to protect others and yourself in situations where you can't physically distance or where there's a risk, and doing all of that to protect yourself and others is the best way to protect society. Our advice doesn't change, but we will not comment on the specific risk management measures or behaviour of a specific individual. We are a community. We need to get through this together. This is not the time to turn on each other.
Thank you, Dr. Ryan. I would like now to call for the second time Catherine Fioncan-Bokonga from France 24. Catherine, can you hear me?
Yes, Fadela, thank you so much. This time I got the sign to put my sound. Thank you. Good evening to all of you. I would like to come back to the allegation of sexual abuses by Ebola aid workers, as I know that Dr. Mike Ryan and Dr. Tedros did follow very closely what happened in the fight against Ebola. I would like to have their reaction on that, and also about the fact that apparently the women that complained were drugged, abused, locked up. And could you give us more details about the WHO people involved? Because we know that people from other agencies and NGOs apparently are also involved? And will you share some reports with names with the press when you have evidence? Thank you.
Thank you, Catherine. Dr. Ryan?
Thank you. We simply don't have any of those details. We have what you have, which is the report in the newspaper. We start from a position of believing those individuals who have suffered abuse or exploitation. That is the first. The second thing, we are absolutely concerned that the individuals who have been abused and exploited receive the proper care, the proper support, and absolute access to justice and a bright future. And we will do everything possible to make that happen. But frankly, right now, we have absolutely no details of any of the individuals, any of the specific allegations. I know David Webb, who leads our more internal and investigational side, and others throughout the UN are working together to establish how much information may be in the system, and they will work. I know that the Director General will and is launching an independent investigation and will make announcements. He said he will make announcements in the near future on that. So the organisation is taking this deadly seriously. These allegations are horrific. And it is awful to hear. And both the Director General and myself spent significant time in the field. I feel terrible to hear these stories. I feel awful for the people affected. I feel awful for the families. I feel awful for the wonderful WHO, the NGO, and the UN staff who have risked their lives over the last 2 years and given their lives to help these people. To think that any group or individual would destroy and degrade our image or the lives of other people is just almost too much to contemplate. But we first have to get the facts. We first have to get this properly investigated. Right now, we have no more information than you have. We will and are actively seeking that information. But we also need to ensure that we're very sensitive in the way we do that, and that those affected by this are not further traumatized by the process.
WHO's Dr. Mike Ryan answering a question there about incidents of sexual abuse reported in the Democratic Republic of Congo earlier on. The Director General Tedros Ghebreyesus speaking about this, saying that he's very saddened by these reports of abuses by alleged WHO aid workers, saying that this kind of behavior will not be tolerated by the WHO, and so it's been fighting very hard to end the Ebola crisis in the Democratic Republic of Congo. And this comes as a very sad news, saying that they are definitely instituting investigations, and anyone found guilty of this will be summarily dismissed. And of course, a question that was asked several times is on the WHO's response to news that US President Donald Trump has tested positive for COVID-19. Mike Ryan definitely answering that question, saying that they are not in the business of zoning in on individuals. All he can say is that they encourage every individual to follow the safety protocols of their own countries, also emphasizing the fact that, as he says, we are a community. We should not be turning on each other at this point. Well, US politicians doing this? This is something we'll find out about later on when we have a full-on debate looking at President Donald Trump testing positive for COVID-19, including the First Lady, and how they're going into quarantine. What does this mean for the rivalry with his presidential contender rival, that is Joe Biden? That's all coming up later on. But for now, the US House of Representatives